Truth, really that's all we know. Keep it real and authentic, this truth be told. Only the truth. Tune in, cause you gotta watch. It's like you with us while we kick it in the barbershop. Here to motivate and inspire. Hosted by the real deal and the God Barber. I hope that you ready, keep it funny and edgy. Let's go. You already know. Truth be told. Let's go.
Black men are about 70% more likely to develop prostate cancer and are more than twice as likely to die from it compared to white men.
Early detection through PSA tests can reduce prostate cancer mortality by nearly 30%, especially when started around age 50 or earlier for high-risk individuals.
Prostate cancer can develop with little or no symptoms in its early stages, making regular screenings crucial even in the absence of warning signs.
About 1 in 8 men will be diagnosed with prostate cancer during their lifetime. For black men, that number is closer to 1 in 6.
The risk of prostate cancer increases significantly after the age of 50. Men with a family history should start screening even earlier.
Prostate cancer in the U.S. in 2025 estimated 300,000 new cases, approximately 35,000 expected deaths. 1 in 8 men will be diagnosed.
PSA screening may cut deaths by up to 70%. Only 38% of men aged 55 through 69 screened last year. And skipping screening increases death risk by 45%.
Advancements in screening. New urine test shows high accuracy for aggressive cancer. MRI plus PSA reduces unnecessary biopsies and improves results.
And T Green, you already know when we talk about brotherhood and stuff like that, we kind of get deep into that. We typically in our community run away from certain things, and those certain things can harm us, can kill us, can even do worse, man, when it comes down to the family dynamic. So tonight, I want you guys to make sure that you are tuned in, make sure that you're listening. I'm kind of happy that we're having this conversation. It's not that I'm kind of happy, Green.
No, we got to be happy.
We got to have this conversation, because if not, we don't know what can happen to our brothers, our sisters, our family members. So I got my boy T Green's in the building, the God Barber.
I'm here.
Also Desiree's in the building. I'm one of your hosts, Real Deal. Tonight,
I'm here, man.
If you haven't subscribed yet, go ahead and hit that subscription button. I just want to go ahead and dig on in, Green.
Let's dig on in, man, because it's like I say, it's like you said, it's much needed, man. And when y'all listen to this tonight, let your pride go. That's our problem too.
Yeah,
we got a pride.
In the building. And also we got Dr. Fitch, who is no guest either.
Yes, sir.
Our podcast. He came on a couple of episodes back, man, delivered a powerful message to our community. I had a couple people call me. Dr. Fitch, like to welcome you back to the show.
Yes, sir.
Dom, how you doing, bro?
Man, doing pretty good. Blessed, man. Glad to be here. Thank you guys for doing this, and ready to share my story.
Yeah, man. You know, I got a phone call, just to get some context to this. I got a phone call one day. Actually, I reached out to you.
Yeah.
In reference to my brother and what he's going through right now. And in that conversation, you hit me with something that kind of threw me back.
Right.
And I had no idea that you were actually going through this. And it kind of, I was kind of upset with you for a little bit, big dog, to be honest with you. You know what I'm saying? But I understand. You know, you went through it, and in due time, you did let me know. And that's the reason why we're here tonight.
Right.
To talk about that.
Right.
If you guys ever heard of prostate cancer, Dominic actually was diagnosed with that. And I want to kind of just go from there.
Okay. Yeah. Yes, our conversation, you called about something else, and I told you, hey man, after we talked about what you called, I was like, I got to tell you that I just went through prostate cancer. That I had prostate cancer. So for everybody, matter of fact, this past Saturday made a year that I was diagnosed with prostate cancer. So this Saturday was a year that I got a call from my best friend, Dr. Fitch, to let me know that this biopsy that I had taken, that it came back, I had prostate cancer. And at that time, you guys, it rocked me. You know what I mean? And I remember that day like it was yesterday. I'm up in training, and I get that phone call. I'm all the way in 4 hours from here at a training from work when I got the message, in a hotel.
That you were diagnosed with
that
prostate.
I was diagnosed. So let me back up.
Yeah.
So in the job that I do, law enforcement, they are very strict on every year you have to do a annual physical. And so this particular year, I go do the physical, and everything checked out fine. And the doctor always will say, hey, do you have any questions, any concerns, anything? And so I hit him up, hey, yeah, doc, I have a question. I say, man, at night I'm getting up in the middle of the night, have to pee. You know what I mean? What's going on with that? I ain't sleeping through the whole night. I got to get up and go use the bathroom.
Was that like consistently? Like
yeah,
every night?
It just was weird. Just odd,
Okay.
And at that time, he said, yeah, Dominic, you 51 years old. You know what I mean?
Yeah.
Your prostate, enlarge. As we get older, your prostate will enlarge, and Dr. Fitch will be able to go into more detail about that. So I said, okay. He say, so nothing big. He say, however, you a black male, and 1 out of 5 black men are have prostate cancer. And he said, for nothing to nothing, let's just do some checks. And I'm not thinking that because I'm good. You know what I mean?
So when you say you good though, I mean you don't feel anything.
No,
right? you just
no pain. I'm running healthy. Doing everything right. But nothing telling me that I have cancer. So when he said, oh yeah, the prostate swell, okay, what's the prostate? He broke it down and all that, and that's all it probably is. Nothing. That's normal.
Okay.
Right, Dr. Fitch?
Completely.
Yes.
so the prostate swells. Does that differ with the age that you are? Because you say you're 51, but
So basically, what happens is your prostate normally gets larger as you get older. So that's why your PSA number, which is a test of it's called like prostate specific antigen, it's like this protein that comes off of your prostate tissue. As you get older, a normal PSA is higher the older you get because your prostate normally gets larger.
yeah.
Prostate gets larger, it can cause you to have more obstructions, so like the urethra, the tube that carries the urine from the bladder down to the penis. Prostate gets larger, that tube gets smaller, so it makes you pee more often.
Oh,
So just peeing more often isn't
Okay.
necessarily a symptom of it. You could just have a bigger prostate as you get older.
Okay, so you can still use the restroom. And it's not saying that you have prostate cancer.
Exactly.
Just because you're going to the restroom.
Exactly.
Right. So that's just
Exactly.
like you said. Okay.
Exactly. And that's exactly what the doctor said. Like, Dominic, they ain't that, you 51. It's just, closing up.
Yeah.
And all right, cool. He said, but however, and like I say, let's check. You're a black male, man, and y'all prone. And I love this doctor, Dr. Lyon. He said, y'all prone to have black men. He's straight up to have prostate cancer, man. He said, so while we at it, shits and grins, let's go do an MRI and take a peek. So I go do the MRI. The MRI come back kind of like inconclusive. They saw some, but nothing major or nothing like that. Then he said, I'm going to send you to a urologist. You know what I mean? So I go to urologist. He do the whole finger test and all that. Yep, it's enlarged, not hard or anything. But Dominic, I can't say you have it. I can't say you don't. Let's do a PSA. Okay, so I do the PSA, and the PSA comes back intermediate. You know what I mean? Like borderline.
Okay.
You know what I mean?
Okay.
Where he says, I can't tell you, Dominic, you have cancer, and I can't tell you that you don't have it. You know what I'm saying?
Mm-hmm.
He said the only way we'll know, he said, you're young, let's just do a biopsy.
Okay.
And I'm like, all right. You know what I mean? Because I'm good. You know,
Yeah.
it ain't nobody scaring me yet.
Right.
You know what I'm saying?
Right.
So the first time I got scared is when I go to do the biopsy, the biopsy prep. You know what I mean? Where these people prepping me for the biopsy, and that's the first time that I got concerned, you know, because they start asking you all these questions, and you got to put who gonna be your beneficiary and all that stuff. So that's when my life started flashing in front of my eyes.
Absolutely.
And I go through and I do the biopsy, and I do the biopsy on the 3rd of last year. Okay, and so I had to go to biopsy was nothing. Just a little sore in between the legs, you know what I mean? And the prostate is in between the how you say it, dog? In between the
The regular way to say it is in that tape.
Yeah, okay.
So that space in between your scrotum and your butthole, basically.
Okay.
Your prostate is directly right there. So when they do a biopsy, they put an ultrasound probe inside of the rectum so they can see the prostate. And then the needles go through the probe. And usually they'll either put it through the rectum to the prostate, or sometimes they'll do it through the perineum. That's the technical name for that taint area. And then that's how they get the tissue out to look under a microscope to determine if it's actually a cancer or not.
Okay.
So they put you to sleep while they do
Yes.
all this right here?
I'm knocked out. Yeah.
You don't want to be awake on that one.
Yeah.
But you know, I know you're going to tell your story. I want to go back. Why is it that it affect the black men more than any other race?
Right.
Why is that?
I mean, honestly, it's a really good question, and they've done all kind of research into it, and it's a few different theories. I mean, part of it is it genetically, more likely because of a heritage from Africa. Some African men actually have increased rates. There's theories on diet. There's theories on increased stresses. Just being a black man in America is more stressful than not. And then sometimes it's also a function of not getting checked out as frequently, so we get diagnosed at more advanced stages. But it's definitely a genetic component because African American men in particular do have a higher rate. So again, they don't know what. It's not one thing. It's probably a mix of genetic predisposition as well as diet and lifestyle.
Okay.
Oh,
Yeah.
Okay. So I'm sorry, bro. So
No. I'm gonna throw it out there because I want everybody to understand. You know what I mean?
Yeah.
Okay, so I do that biopsy on the 3rd, and I had training up in, I forgot the area. Oh man, but it's 4 hours away from here, and I'm in a hotel, and I was sore, but nothing major. You know what I mean? So just a little sore, and they say we're going to get back with you. You know what I'm saying? So I end up on that Thursday, which was the 10th. I get a phone call from the doctor's office, and I'm in class. I see it, and so I run out of class. And the lady was nice as ever and say, "Hey, Mr. Harris, we have your results. You need to come see us so we can talk about your results." Hey, man, I know when stuff is serious because I wanted to hear, "Hey, Mr. Harris, you good?"
right there on the phone call.
You good?
Go ahead, tell me I'm good.
The lady said, "I want you to come to the office so we can go over your results." Yes, ma'am. When you come? That Monday. All right. Yep. We got to set up for that Monday to come, because it's Thursday at the time. I immediately hang up and call Dr. Fitch. "Hey, man, These people just called me, talking about come to their office. What's
going on?
What's going on?
Yeah.
No, Dominic. You know, y'all see how he talking. He real. He bringing me, get me off the cliff. You know what I'm saying? I'm about to jump off this. What? Yeah. He talks me off the cliff. No, Dominic. That's how, you know, we bring everybody to the office. Explain that, Doc.
Nah, it's the truth. So to your point, like you want to hear over the phone, like, you know, everything's good. I got a strict sort of policy where for results, the reason I have everybody come in is because if I only have people come in with bad news, they automatically know it's bad news. They automatically assume, right? And they don't give me the opportunity to really explain the whole deal. So whether it's good news or bad news, if it's results, I need to see you, right? So according to that way, you don't automatically assume the worst.
Okay.
So what I was telling him, I was like, it don't necessarily mean it's worse. It just means he got to talk to you.
Okay.
Right? You know?
Okay.
I don't even want to answer what. No, I'm with you now. Did y'all see my face? Yeah. When I got off the phone with him, I say bullshit. When I got off the phone with Doc, I say that's some bull. Yeah. I swear, you didn't want to accept that from you. Man, that's my man. I love him to death, but I wasn't accepting that crap, man. The lady just said, come to that office. You know what I'm saying? Right. But the awesome part about it is, this is my friend. I told him what I was going through. He said, listen, what you're going to do is, you're going to put me on your stuff. So when your results come back, I get to see your results, and I'll be able to talk to you about it. You know what I mean? Because he does have a gift of taking this scary thing, you know what I mean, and being able to talk to people in our language. You know what I mean? For us to understand. Absolutely. And I love it because I've learned so much out of our 18 years being together. Where he breaks it down, where you understand what cancer is, and you know, man, he just, you know what I mean, it's just amazing being around him. But at that time, I was like, I ain't believing that shit, dog. You know what I'm saying? But he said, check this out. I get to go see. That means they got the results. I'm gonna go see. All right, so I'm waiting, you know what I mean, for him to come back. So I get out of class. I done made it back to the hotel. He texts me, and this a Thursday. So we meet Brotherhood of Men on Thursday, right? Okay. And I already let the team know, y'all, I'm gonna be out this Thursday for the group. So y'all, you know what I mean, y'all got to cover for me. You know what I mean? For the thing. I put my phone on vibrate, and I'm sorry, y'all. Okay. He ended up texting me saying, "Hey, you in group today?" That's when I started getting nervous. Okay. I know he ain't forgot that I told him that I'm out of town. Yeah. And I'm like, roll. And I said, no, Doc, you remember I told you that I'm out of town? Like, y'all, certain stuff I pick up real good. Yeah. And I do it for a living. You know what I mean? Absolutely. When he texts me, I say, holy crap. Doc knows that I'm up here. Why would he be texting me? And this what gave it away. When he called me, when I saw him on my phone, my heart started beating real fast, man. Because it's two things. Me and him don't talk on the phone. That joke ain't talking to you on the phone, man. He the one that got me texting. You know what I mean? Doc ain't talking on the phone. If Doc call you on the phone, we doing some real hardcore business at the time. Now, you just talked to you earlier today. Yeah. You done text me, and now you calling my phone.
Yeah, that did get away.
My best friend had to break it to me that I had cancer now. Had to break it to me that I had cancer. Yeah.
What were you feeling at that moment?
Dude, I told y'all I ain't gonna cry. Hey, but no, man, it takes the air out you. It totally takes the air out of you. When, you know what I mean? Yeah. That's the worst. The C word. Somebody tell you got the C word, big dog. Right. My little dude flashing in front of my baby, you know, who gonna take care of me? I already was dead once he said the C word. You know what I mean? Yeah. You know? And I'm like, oh my God, who gonna take care of my baby? You know what I mean? All this other stuff, the group, and you know, I got all kind of crazy stuff going through my head. But what was so awesome is when he called me, he assured me, hey, I already got with the other friends, because all our other friends that, his friends that we travel and do stuff together are doctors too. He said, I already got with my other friends. You having surgery. He said, you know what I mean? You having surgery. We going to this doctor and you going to be fine. That's what he told me.
Let me ask you something about that. Because that's a hard pill. He just told you that you do have cancer, and everything in our minds, we automatically think the worst.
Oh yeah.
I mean, we don't care what type of cancer it is.
Right.
It don't even matter.
Yeah.
We automatically thinking the worst. My days are limited. I don't know. You know what I'm saying? I understand that some people do recover and get over, but if it's me, I'm tanking. You know what I'm saying? I'm just automatically tanking. So when he said we gonna be all right, did you believe that?
No, I didn't believe. I didn't believe. I automatically went into a dark place, and I was in a dark place for a while. You know what I mean? Like it got to the point where I'm on my couch. You know what I mean? Not moving, don't want to go nowhere or anything. But I must say, he's God sent, because, man, he was calling me every day and all that, and we could see how he felt. We had to call and tell me that. But yeah, man, I automatically went into a dark place. I'm finna die. You know what I mean? It's gonna end like this. You know what I mean? And that's the last thing I wanted is to pass from cancer, because I watched my grandma, pass from cancer. And yeah, it was hard. It was super hard, man. But he was like, no, you gonna be all right. You know, you're gonna be all right.
I feel like with cancer, though, I feel like we become mentally defeated.
Oh, 100%.
Even, and like you said, just hearing the C word, no matter how early detected it is, or how, you hear it and it's just like, oh, this is it.
Yeah.
And you start making those plans.
Yes.
Opposed to figuring out treatment options and things like that.
Yes. And you absolutely right.
Yeah.
But the thing that snapped me out of it was him. He kept me, snapped me out of it. You know what I mean? So fast forward from that phone call.
Can I ask something real
Yes,
quick?
sir.
I know, for you, it had to be somewhat of an advantage to have someone in your life
Absolutely. Yes.
Yeah.
that you trust. Even though it was still hard, but you trust, that can talk to you, that can educate you about cancer and with the type of cancer that you have.
I'm a firm believer our steps are ordered. God ordered our steps. He put people around us for a reason. And right now to this day, I totally feel this man was put in my life for that moment of my life. Y'all understand what I'm saying? Because I trusted every word that he said. And like I say, it snapped me out of it, because when he said it, after I got off the phone with him in that hotel, I had started planning everything. What color casket I'm gonna have, and all kind of stuff. No joke. No joke, man.
Like
you know, and but the trust that I had in this, and the love, and how he just came at me with it, I had no, you know what I mean. Are you gonna get second opinions? Are you gonna get this here? Are you? I don't want to hear none of that. My dude said, I'm having surgery and I'm going to that doctor. That's what I'm gonna do. I'm gonna do. You know what I mean? And so that's how it happened. So that Monday, I go see my regular doctor, and I go see my regular doctor, and the one that did the biopsy, and it was funny. I don't know why I had to go see him, because he know Doc already had done told me. So I go in and see this man, and he tells me the moon, the stars, and all this aligned on me to be able to catch this. That's what he told me, straight up, because it usually don't get caught early like this. You know what I mean? Doc, you'll tell them like what you saw, please.
Yeah. So kind of going back to what you had said before about having it was having the benefit of having somebody that you can talk to and trust, right? You know, I think that's huge for anybody out there who gets diagnosed, because not everybody will have that automatically, but you should advocate for it. So, like, if you go to a physician, nurse, PA, in the medical field, a lot of people are super guilty of, you know, not looking at people as people and more so as numbers, just trying to get to the next patient. Every patient that comes in, no matter how big or small that cancer is, that's their cancer. That's their story.
Yeah, absolutely.
So you have to treat every person as if that's their story. I may say this 1,000 times, but it's the first time you hear it. So it's my job to make sure I present it to you like it's the first time I've done it.
Yeah.
So I encourage people, like, if you come out of a doctor's office, you feel like you don't know what was told to you, you go back in there. You make another appointment. You know, again, you may have to advocate for your loved one. There's no reason for you to come out of a physician's office and not know more coming out than when you did going in.
Yeah.
I can't tell you how many times I've seen patients over the years that by the time I see them, and I'm usually the second, third person down the line, because when somebody sees me, they've been diagnosed already. I'll talk to them, and to this day, they'll still say, "You're the first person that told me what's going on," which is ridiculous. You've had this diagnosis for 6 weeks, and I'm the first person to tell you? But what that means is that, you know, a lot of times people don't take the time to talk to people. And I hate to say it, a lot of times if they look like us, if they from a lower socioeconomic background, because I've been around here long enough now to know the same thing happened with poor white people and Hispanic people too. It's socioeconomic more than anything else for people.
Yep.
So, you know, I encourage those to just be your own advocate and be advocate for those around you. If you don't understand, don't be afraid to ask.
All right.
Ain't no dumb question if you don't understand.
Absolutely. I definitely.
And that's, you know, and that's like that C word. That C word. We've been talking about that C word. That's why a lot of people, a lot of guys, don't go to the doctor.
Right.
Because they don't want to find out what's wrong.
Right.
Nah.
You know?
Right.
And it's a lot of people right now hurting, got pain, but don't even want to go to the doctor to even find out because they're afraid.
For sure.
Yeah.
They're afraid to get some news.
Right.
You know, and just by hearing you and how you felt, your best friend knows all about it, and you still felt like, man, my life might be
This might be
it's
it.
ticking.
Yeah.
It's ticking. So the average guy, they're not trying to go find out.
Right.
You know, so I think this is very important to have this segment on prostate and on any cancer.
Right. For sure. Right.
Go get checked out. I mean, I'm about to be 55 next month, June 1st.
Right.
I'll be 55. I probably need to get checked. You know, I feel good.
For sure.
But
Right.
still, you know, I can let my pride go. I get a physical every year.
Yeah.
So I can let my pride go. But I think a lot of black men need to go to the doctor, man.
Right.
Just try to find out what's wrong.
Right.
Yeah.
I mean, they do everything else and don't be afraid.
Right.
All right.
Right.
They got this old saying that said, the Nile ain't just the longest river in Egypt. You know, because
Okay.
the bottom line is it's one of the most powerful forces out there. You know, people can know something's wrong.
Yeah.
I'm talking, I've had patients come in the office that I say, what I'm seeing you today for? They say, oh, you know, I got this lump on my breast, and then they pull their shirt up and it's a hole, like an actual hole in their chest. I say, how long that been there? Oh, a couple months. That's been there for years.
Wow.
But you didn't want to go in because you didn't want to hear that word and what everything comes with. Because once you get diagnosed, now you're talking about this treatment, that treatment, going to the doctor. And for a lot of people, they're like, you know, I'd rather not even know.
Yeah.
You know, and it's sad because a lot of times so many things have to be taken care of when it's super early, like his prostate cancer.
Yeah.
If he don't go get his PSA, if he doesn't listen to the doctor, get the MRI, if he doesn't get the biopsy, either one of those steps, he could have just been like, nah, I'm not doing that. I'm good. I feel good. Why would I go do something if I feel good? Right? But that's not what prevention's all about, right? You know, as a quick aside, at 55, if you haven't had a colonoscopy, get one. You know, because
I did all that.
yeah, because the thing is, you're gonna pay for insurance anyway.
Yeah, I did everything.
You know,
I
I mean,
did-
use it,
Yeah.
right?
Yeah.
You know, so it's super important, especially in our community, because
Yeah.
these are things that can happen, and you can take care of, so you don't got to come see me, right?
Right.
You know, so it's just prevention stuff.
So Don, what happens I keep trying to put myself in your position, and the only thing I can keep thinking about is, I start thinking about my loved ones and my family. What do I do next? Right? Like, how much is this gonna cost me? Is it gonna hurt? What is, all those things run through my mind. Like, as you receive this information, as Doc is telling you, hey, this is what we're gonna do. You in your house, did you share that with anybody? Family?
I shared it with like really, really close, not everybody. It's family members right now going to find out that I had cancer through this podcast that I didn't even share. But I wanted to wait. 2 reasons. I wanted to get back to Dominic because I don't want people praying for me to, you know how people is, you know what I mean? Oh, Lord, that good for him, you know what I mean? I ain't want none of that craziness. I don't need no bad, juju on me, you know what I'm saying? Absolutely. Number one, I'm just being honest. And 2, I knew I was going to put it out here to save other black men. And I wanted to be back so they can see me and like, ain't nothing wrong with that dude. It's not. I got it taken care of. So that's why I had in my mind, and once I start going through the journey, and the journey is rough, y'all. And I'm not gonna sit here and try to play like I was Superman and it was easy and all that. Oh no. The journey was hard, but I knew what my ending was going to be and what I was going to do and the advocate that I was going to become once I made it off on the other side. And but yeah, it was from going to the doctor. I had to go back that next day. That Monday, and I go and he pretty much tell me, "Hey man, you're lucky that this was caught." You know what I mean? In so many words. But you have it, and you're going to be good. You got 2 choices. You got this doctor in Sarasota, and then you have this other doctor named Patel in Celebration, Florida, that you could go to. Guess what? That's the doc that doc already had told me that I needed to go to. Okay. So you tell me your steps are not ordered. So when he flashed this other doctor, I want to go to him. Period. You know what I mean? Because he already said, no, we going to this doctor. So when that man gave me 2 options, and the other one was the man that my dude said go to, I want to go to that guy. But guess what? He went to school with this dude. My doctor went to school with this guy. He instantly texted this man on the phone and said, hey, I got a patient that I'm going to send to you, blah, blah. Went to his nurse, get him set up with, now y'all tell me that ain't God. A couple of days later, I'm in Celebration, Florida, getting checked in and doing my paperwork for them to put me on the schedule to have the surgery. So I think about 5 months later, I have the surgery, and that's when it got real. Having the surgery. It's called a Da Vinci robot. So I had robot surgery, the Da Vinci robot, where Doc can break that down more. That's why I'm glad he's here. Where they blow up my cavity, turn you upside downwards. The doctor's on one side of the room doing a remote control, and that's how the robot is doing the surgery. He's doing the surgery, but the robot is doing it like a joystick. Wow. 6 holes in me. They go in, cut the prostate out. You know what I mean? Really, and this guy is good. He's done 20,000 surgeries. You know what I mean? Like he's the man. When I went to go see him, he was like, backing up a little bit. When I went to go, consult with him, he told me straight up, "Oh, you're gonna be fine, cause we caught it early." He say, if a person could get cancer, it would be your case. He say, cause everybody that I'm gonna see after you leave here won't have this case. I caught it that early. It did less damage. I think I had 6 to 10% of my prostate had cancer, which that is low. Some guys, the whole prostate is full of cancer. You follow what I'm saying? In that case, they cut your bundles, your nerve bundles and all that, and that's where you have more complications, you know what I mean, after the surgery and stuff. But he was able to get in and save 100% of my bundles, get the cancer out, you know, get the prostate out, you know what I mean, take it out, and now it's recovery time. But the awesome part about it is having Doc on my side and he's telling me I walked, exercised, I already was healthy and all that. It made surgery, I bounced back within a month like I didn't have it, but I had to wait 6 weeks before I could lift stuff. So I did exactly what these people told me to do.
Right.
Call Doc, because you do have side effects, incontinence, and then you have ED. You know what I mean? But if you do what these people tell you to do, you will bounce back. And y'all, I'm always been an overachiever, you know, so I'm in there and the lady teaching me Kegel exercises and stuff to stop the leakage. And I went and bought a clicker so I can count mine, you know what I mean? Click. Oh, I'm at the red light doing the Kegel exercise, but I'm clicking because I want to make sure I do the exact numbers that this lady telling me to do. And within like 3 months, I was back to normal, you know. And my big thing was just sharing that because we need to get together, especially for the people that do get diagnosed. Well, let's back it up. People that need to go get checked. First off, you follow what I'm saying? So you can catch it early. You know, if these people telling us 1 out of 5, if you're in a room, start counting. You know what I mean? It's just so you can see how major that is. 2, we need to communicate with each other. You know, I have another friend that just went through it. I found out, you know, he put it out on Facebook that he did. I reached out to him so we could get together so we could talk about it. Man, he ain't never called me. You know what I mean? We get so, and I wanna kick that door in to say, the journey will be way easier if we cipher on different things. Because I did get on a support group on Facebook, and Doc told me to watch out for it. But that group helped me out because guess what? They told me, hey, you're gonna have the catheter. This is what you need to get while you got the catheter in. When you go get the catheter out, you need to have this prepared. You know what I mean? When you after the surgery, you need to be walking right after surgery. You know what I mean? It'll relieve the gas in your chest. You know what I'm saying? You need to do this. You know what I mean? These are the different paths that you need to get until you're constant. You know what I mean? You know, and stuff like that. But we need that for us. Right. We need to open up, and I'm here. You know, and I feel that's what I want to do, to share, to be a person that you can talk and, oh, you're a big dog, I did this, you know what I mean, or look out for this, or when you go up there, you need to wear this, or, you know, this is what you need to do with the catheter while you in it for a week or so, and, you know, stuff like that. And put the pride up, like T. Green said. This ain't no prideful thing, man. This is what men are going through, and a lot of us are going through it, but we going through it in silence, bro.
Let me ask you something.
Go ahead, real.
Let me ask you, did the doctor tell you when this thing may have started? Was he able to kind of pinpoint?
Dr. Patel, when he came in and we talked, he told me that mine started when I was 40. I'm 51 when I went to go see this man. When he looked at my MRI, the PSA and all that, he told me started when I was 40. And then he also told me, anybody that have your blood, your sons, your cousins, anybody that's connected to you blood-wise, male, they need to start getting checked at 35.
Automatically now.
At 35.
And that's it. Okay, so was there anybody else in your immediate family that had prostate?
So, backing up, when they told me, when Doc told me I had cancer, that next day I told y'all I'm crushed, I'm running through, and I end up calling Georgia. My dad was from Georgia. Wasn't close to my dad and all that, but my family on his side is up there. And I'm like, y'all need to tell me what's going on, with my genes, because these people saying this thing probably hereditary. What did this man die from? Because I knew my dad had passed from cancer. Guess what? I find out not only my dad, but all of his brothers died from cancer, either colon or prostate cancer. True story.
Now, something to keep in mind is that the majority of cancers aren't actually hereditary. Like if you look at all cancer diagnoses, prostate cancer included, it's about 10% that are genetic / hereditary, meaning it's in your family. So the vast majority of them are either based on lifestyle, bad luck, number of people living, sort of thing. Because what cancer really is there's a accumulation of these mutations in your DNA. So 90% of cancers are not, but in family histories like that, that's one of the reasons why Dr. Patel was like, okay, well, you should probably have, your family get checked sooner. So let's say, heaven forbid that, you get prostate cancer at 60, 65. Doesn't necessarily mean that your sons are going to get it, or even means going to get it early. But it's just it's a numbers game, right? So if it's already 1 in 6 across the board, then it's just a lot of people in general.
Yeah.
You know what I mean?
Yeah.
So right now, the recommendations for black men in particular, like without any sort of family history, is 45 to start PSAs, right? 50 for the general population. But if you have a family history, i.e. 1 or 2 first-degree relatives, like dad, a brother, or even your uncle, that gets pushed to 45 or even 40. So what I typically recommend people to do, black men especially, even without family history, get initially a PSA at 40. If your PSA is on the low side, you can probably do it every couple of years until you're 50. I'm sorry, until you're 45. If your PSA is even moderately elevated at 40, you start doing it annually. And you got to remember, too, the PSA isn't like a, unfortunately, overly accurate test, which means that a lot of times you can have an elevated PSA and not have cancer. I mean, that's what I was telling my mans here essentially at first, because I was trying to keep him off the ledge, because as soon as the first thing he heard, he was already at the ledge.
Yeah,
so I was
right.
constantly bringing it back until we had to have a talk. Only because all those things could have still technically been negative. Even MRI, nothing was 100% until you get that biopsy. And even saying, because I always get the question too, like, when did it start? I think he just kind of threw out 40 is because it probably was in there for several years. You can never really look at tissue diagnosis or an x-ray, a single x-ray, and tell somebody how long it's been there. Because you got to have 2 x-rays different points in time to see how much it grew. But prostate cancer, we know, typically speaking, if you find somebody with a Gleason 7, which you had, that means it probably progressed from a Gleason 6, which puts it at least 5-6 years before that already. So that's kind of why he threw out that 10-year number, because it had been there for a bit.
Yeah.
Like, they did, it's this big series of autopsy studies where they just took guys who died of natural causes and they happened to check out their prostate. And that's where that number came from, 1 in 6, because if you just take somebody's prostate out after they pass from whatever, you can oftentimes find little bitty areas that it was either really early prostate cancer, they would have never died of it, it was technically in there. So they would live long enough that it became more like more prostate they had to deal with. So yeah, that's why it's, and it's, I always make sure people understand that doesn't mean everybody has cancer. Because something I hear all the time is that we all got cancer, it just pop out at different times. It's not exactly true. Not everybody automatically has a cancer, but we all can develop it because of what cancer is, right? Cancer is your normal cells. They get enough mutation, they go a little bit haywire, and they start acting all crazy. But because they're normal cells, your body can't really identify them that easily. So that's when people get confused. Like, it don't mean everybody got cancer. You have the chance to get it, but some people can heal up those mutations better, right?
Right.
Everybody got an uncle that smoked for 75 years and died, and got hit by a car or something,
Right.
And then
Right.
conversely, you got somebody that never smoked, he got lung cancer.
Right.
The difference is that old man had, he was just born with a gift for fixing mutations. As fast as he was smoking and jacking his DNA up, his body was able to fix it. He didn't do nothing special to get it. He was born that way. But your average person, adding up all those mutations, is going to increase your risk of getting cancer later.
Gotcha.
Yeah.
But all cancers have stages, right? I be hearing like 1, 2, 3, 4, 5 stages.
Typically, yeah, he put it in stages. The stages is just a way to pigeonhole stuff to make sure you give the best treatment options for that stage. Yeah.
So what stage with Dominic? What he was in?
So it was technically stage 2, but for
okay.
prostate cancer, rather than staging, we put things into risk groups.
Okay.
Like low risk, an intermediate risk, and a high risk. And he was intermediate risk because of the Gleason 7.
Oh.
So can you tell us a little bit more about the numbers? Like, because I go in and my junk out of 10.
Right.
I know what they're gonna say, but I need those numbers. The numbers help me.
Yeah.
You know what I'm saying?
So when you go, the first thing they'll do is, and this is actually important too. In the past, one of the reasons why guys in general didn't get screened, especially black men, was the way you get screened was with a digital rectal exam or the 1-finger salute, what I used to call it. So nobody want to go and get a rectal exam. I don't want to give them. I tell guys that all the time, like, I don't want to do it either. So, but nowadays, they did a whole bunch of testing, and now just getting a PSA screen. You don't even technically have to get a digital rectal exam or a finger test to check for prostate cancer. Just a PSA, which is just a blood test. So that takes down a lot of the barriers for people to be like, I want to go get screened because I got to tell me to bend over and drop my pants.
Yeah.
Just a blood test.
Yeah.
So the PSA number basically gives you an idea of what the risk of having something boiling on in there. Again, the number being elevated itself doesn't indicate whether you got cancer or not. So up to 4 is typically a normal number for somebody 50 to 60. If you're 70, it could be up to 6 and be normal. So that's what I'm saying. That number kind of changes based with age, right? So you go in and get a PSA. If right now your first PSA is 3, right? If you got a family history, that's a little bit on the high side for somebody your age, but you could probably watch it get another PSA if it keeps going up. And that's the difference.
Because we got baseline now.
Baseline. PSA keeps going up every 6 months. Now you can start getting suspicious because a regular prostate shouldn't keep making PSA going up. Only cancer cells will do that.
Okay.
So then what will happen is that number, that first PSA number should, again, be less than 4. If your first one is already over 4, so like a 7 or 8, the higher the number, the more suspicious we get. Sometimes, unfortunately, I'll get somebody, they come in there, and the PSA is, 500. I know they got cancer. PSA ain't going to be 500 without cancer. You still got to get a biopsy, but that's cancer to proven otherwise. But your PSA can be between 10 and 20, you can have an infection. So even then, it's not automatic, but you really got to start looking.
Yeah.
Once a PSA is elevated, next step is typically like an MRI. An MRI is a kind of an X-ray, but not really an X-ray because it's magnets. Okay. So you go in, it gives us a picture. If it's something looks suspicious in there with an elevated PSA, the next step is they got to get tissue. That's that biopsy the needles are talking about. Because you can't diagnose cancer without looking at it under a microscope.
Okay.
Once you get that biopsy, with prostate cancer, that's when you hear these numbers called the Gleason score. So a Gleason score is only for prostate cancer. It's basically a number that kind of gives you I call it a subjective idea of how aggressive or non-aggressive. It's a score between 1 and 10, but typically the number is like between 6 to 10 because the way they come up with it is they look under a microscope, they look at the pattern. So like imagine a pattern on the floor, like how many speckles or how many waves, right? A few speckles makes it like a 1 because it's almost normal. If it's a ton of speckles, ton of waves, and looks all aggressive, that makes it a 5. They look at the second most common pattern, they give that a score of 1 to 5, and then they add them up. So in Dominic's case, what he had, his most common pattern was 3, then the secondary pattern was 4, so that's what made it a Gleason 7. If it's a Gleason 6, that's typically low risk. People with Gleason 6 sometimes can just watch it. They only got to treat it sometimes. If you got a Gleason 8, which is like pattern 4, like 4 plus 4 or a 9, that's aggressive. And then, that's when you got to really get after it pretty quick, either with surgery plus radiation, sometimes radiation and hormone treatments. So the Gleason score really helps us figure out what risk group, which then in turn helps you figure out the best way to treat.
So it's no way to prevent prostate, like certain type of foods, exercise. That ain't got nothing to do with it. Nope. So there's no way to prevent it.
Well, no, that's not actually true. I mean, once you have it, exercise and food ain't gonna get rid of it. But it's things that we can do to decrease your chance. It's all about decreasing the chance of developing these things, right? So to your point about food, there's certain foods that we know that increase the risk of developing prostate cancer. Unfortunately, a lot of the stuff we eat, right? I love bacon. Gotta love bacon. But bacon's one of them. Processed foods, red meats, diets low in vegetables, high in fat. Those things all we know increase the risk of prostate cancer. Inactivity, being overweight, these are all things that increase the risk of developing all types of cancers. So to your point, the things we can do to decrease: exercise, watch your weight, eat more vegetables, less processed foods, lean meats, limit your red meat, more fish, more poultry. All those things decrease the chance for sure.
So we know that prostate could eventually kill you going untaken care of, right?
Yeah.
But let's say in Dominic's case, and I don't know Dom, did that affect your sex life? Like, does that affect? And you said ED. You said ED initially.
Before or after?
Okay. Right. That's just because I don't know. You said your level was at a certain level. I'm pretty sure if you catch it, like you have surgery, you survive, you're living, but it can do damage to your prostate where you are affected in that area.
Right.
Eventually, right?
Mm-hmm. So before I found out, no problem whatsoever. Have no idea. I'm functioning and beat my chest and all that type of stuff. You know what I mean? I'm good.
Yeah.
After surgery, that's when I was telling y'all you have side effects.
Okay.
With the incontinence, with the because we'll have doctor tell you again, they totally cut it out, and they have to cut your urethra and put it back in your bladder and all that type of stuff, and put a catheter in until it heals. So you have incontinence, you're leaking. You know what I mean? When you drink, how on the cartoon Bugs Bunny get shot or he shoots somebody and he drink the water, it come out the hose. After surgery, that's how I was. True story. After surgery, that's how I was. If I drink something, it came right out.
Okay.
And that was a scary feeling because now I'm broken. Like, oh my God, what's going on? I'm calling doc. Oh, Jesus, man. You're going to be all right. You're going to be all right. We're going to get you to the pelvic flow therapist because it's a certain amount of time before you can start doing something because the body, all that got to heal first.
Okay.
You follow what I'm saying?
Yeah.
And once all that healed and they unleashed me into pelvic floor therapy and all that stopped. You know what I mean? Because I did what I needed to do, the exercises and all that stuff. Now with the ED, that was the scariest part. All my life, I ain't never had an issue. But after that surgery, I called this cloud. It was clouded with him. Hey, man, this thing is dead. What the fuck? Hey, man, but guess what? It really gets to you. That really out of everything.
For a man.
Listen to
for a man.
If we gonna be truth be told, that's the hardest part of the whole surgery. Yes, the cancer scare you, but when you done and you do that first test and they tell you, hey man, you undetectable. You know what I mean? Matter of fact, I just took one the other day because I go do a checkup tomorrow. Okay. So I had to do a PSA, and right now, doc, I ain't sent it to you, but it came back 0.04. You know what I mean? Undetectable. Okay. You know what I mean?
Yeah.
And but man, I call him, be like, hey, man, I'm in the shower. I hit that thing. That thing ain't do nothing. Hey,
They just real with a smile.
That ain't do nothing. Scared the fire out of me, man. Like, oh man. But the awesome part about it is, they said, hey man, you're going to have a full recovery. Now, let's go back. When I told you my prostate was small enough where I only had 6 to 10% that it beat my prostate up, this doctor was able to save all my nerves. Some guys had to take all of the left side nerve out. That's where if the cancer ate up one side of the prostate, they have to take the left side. They have more problems coming back. Some dudes, all the nerves get cut out. They just got to cut everything out to get the cancer out. This man was able, and he told me, guess what, Mr. Harris? I get to go in and concentrate on your bundles. I'm not worried about the cancer because it was so small. It took me a minute to understand what he was talking about. But what he was saying is, I get to go in and save all your nerves. Now, to let y'all know, that prostate, all of your sex nerves is around that prostate. So when they take that out, they got to cut around those nerves to get the prostate out. I was blessed enough, they save all my nerves.
Okay.
And your boy is back. You know what I'm saying? Your boy is back. But however, they still got medicines and all this other stuff where you still be able to, you know what I mean, have sex and all that. But coming back natural, it takes time, but it comes back. But it is scary and it is mental. It start messing with you, man.
So let me ask you that, because see, that's one way of taking care of that, right? By the surgery that you have, but then there's radiation, right? And if Doc, you tell me if I'm right or wrong, where that could be more targeted, sculptured out to make sure you take care of everything. The radiation, like, is that like atomic bomb? It just take it. It just kind of went there. You.
Nah.
Okay.
It's precise too. So the biggest difference is when it comes to erectile dysfunction, ED, soft dick, whatever you want to call it, right? All the kind of same thing. That is a big scare for a lot of guys. Talking about denial. No, a lot of guys is like, as soon as I tell them, like, whatever treatment you do for the prostate can affect that, because as Dominic alluded to, if you imagine your prostate, keep in mind, the prostate's only function is a sex organ. It doesn't have any other function. It actually makes semen, and the semen is what basically keeps the sperm in check and gives it somewhere to swim into an egg.
Okay.
Right?
Okay.
So even when you have a vasectomy, which you're cutting the tubes to the prostate, the prostate still functions. That's why you can still orgasm, you still nut, but it's basically no sperm in it. You can still have semen, but no sperm, because the prostate is what makes the semen.
Okay.
So that's the reason why these neurovascular bundles. So imagine like two plugs that plug into each side of the prostate that gives it all the juice for you to get an erection.
Yeah.
Right. If your cancer is in the middle part and they cut out the prostate, they can cut around those plugs so those plugs are still intact.
Okay.
Because it's basically giving the juice to your penis.
Okay.
If the cancer's around the edge, now they got to get the cancer out, which means now they got to cut deeper into where that plug is located. So the plug comes out, now you don't have as much juice going in there, so that's why it's hard to get erections. Now, whether it's surgery or whether it's radiation, both of them can affect erectile function about equally, just different ways. So in the surgery, it can happen more rapidly. Like right after surgery, it's like breaker 19, what's going on down there, and it's immediately it is radio silence. But then with therapy, all kinds of stuff, 3 to 6 months after, where you start getting some life back. Radiation, if you get radiation, you still got radio contact, for that first year and a half, and then you can get vessel changes, and then that's when it can start changing some. So the numbers depend on the surgeon, depend on, the patient. The numbers I typically quote to people is that you could expect anywhere between a 30 to 40% sort of reduction into whatever your baseline is. So if you Superman at the beginning, you could say, okay, maybe you go down to 70, 80% on average to whatever your function was before. If you already was coming off the bench when you started, it ain't going to get better. And that's what I always tell guys, because I had this old man tell me once, I seen him a year after treatment. I said, how's it going, man? He said, I haven't had my dick hard in a year. and he was already 75. And I said, all right, thanks for letting me know. In a year. And I was like, hey, so I said, so when's the last time you had an erection? He was like, 2 years ago. I said, I already treated you a year ago, man. So it all kind of depends on where you started. But the most important thing is this, what Dominic said. Though that is a completely understandable and rational fear, because I had the same fear, it's important to note that there's so many treatment options out there that as long as I know about it, urologists know about it, it's all kind of stuff you could do. All kind of stuff you could do. The Viagra's and the Cialis of the world is just the tip of the iceberg. They got vacuums, they got injections. And honestly, if you're young enough and sexually active enough, they got implants. Implants are amazing.
Green face.
I already have plans. When I hit about 75, if I'm so lucky, I'm gonna get me one just on shits and giggles.
We got women get implants.
Period.
The chest. Implant butts.
But wait, so
So you get an
is that
implant?
something like what Ocho Cinco said? He did something
Oh, did he?
when he
Well,
was.
he said though. He said he was lying.
I don't know.
So hold on now.
I don't know.
Listen. Okay, we hear that the women get implants.
Right.
Okay, you talking about guys get an implant,
Penile
birthday tube?
Yes.
Penile implant.
I'm saying do it work? It ain't gonna work, is it?
All the guys I know, the guy want to love it. You know, because
They love it.
Yeah, because what happened is, so the way to design it is, and the surgeries are better and better, so you have less complications. And like, you know, back in the, I say 15, 20 years ago, they didn't do them as much because you got more infections and stuff. But the devices are so much better now. So what happens is you basically have these, imagine like a small banana-shaped balloon. You put it in both sides of the penis. It's called a corpus spongiosum. It's the two sides of it, right?
Yeah.
And then it's attached to basically like a water, like a little bag full of water. And it's inside your scrotum.
Put it up. Put it up.
Yeah. So basically, you essentially you click this little button that's in your scrotum and you inflate it like an inflated balloon. So you inflate your penis up.
Man,
And you can still have an orgasm.
hold up, man. Like you a transformer, man. Like transformer, you push a button like a remote control.
Listen, I can't wait till they have Bluetooth on this. I'm just gonna.
Man, wait, hold
You
up,
know
man.
that's coming.
Oh,
Wait, Doc, I want to make sure I heard you right because I don't think I heard you right.
I think you did, real.
No, I didn't.
I think you did.
You did.
Did you say? All right, that's the term that you said. If I'm coming off the bench,
Yeah.
So if I'm coming off the bench, I ain't a starter.
Right.
You know what I'm saying? I'm about 4 inches.
Right. Right. You can't get it longer. It don't work that way. You can't go from 4 to 6.
Okay, so that ain't what.
I didn't know.
It's
Because a girl,
It's just making you. It's just making you.
Okay.
If you short jabbing, you gonna stay short jabbing.
If it gave you length and girth, it would be billboards out there. No. I'm talking about just function.
Okay. And then you're standing up. So
Yes.
Okay.
Yeah,
So
because the
you
implants
have
were
to.
Yeah, that's what I'm thinking.
You have to pump that up, Doc.
Yeah.
You pump that up.
Yeah.
Push a button.
They say you
It's
push
like
a button, yeah.
It's like a little pump. You pump it.
That's
couple
crazy.
pumps,
See?
and inflate.
Oh, Lord.
Yeah. So again, I mentioned that because if that's the biggest fear to stopping people, they need to know that there are options. There are options.
Okay.
Especially if you're young. Now, I mean, if you're 75 years old and you're having sex once a year, you don't get an implant. Don't
Right.
make sense.
Right.
But if you're in your 50s and 60s and you still got a sexual life, it makes complete sense. And that's after you try all the other stuff. Because I'm gonna tell you. Again, truth be told, these guys, everybody watching porn, they say these guys, I won't say effing, but having relations for like an hour, they all on shots. They all on shots. These little tiny diabetic needles that you basically had this medicine you put in there, and it keeps you erect for about 45 to 50 minutes. These is porn stars taking these shots. So even the shots work.
I always wonder what was going on.
Like it's you.
We don't know what we talking about the red pills on his show. It's about 36 hours. You go when they say 36 hours, you don't be standing up for no 36 hours, man.
That's basically Cialis. So it's different types of they call it PDEs. It's like basically dilator pills. And Cialis is basically good for 36 hours. So it gives you a larger window where you can still get an erection easier. Whereas Viagra's window is like 4 hours. And then like a couple other ones are like a little bit shorter. So Cialis has the longest half-life. So it don't mean you just, at erect for 36 hours. That's dangerous.
That would be
Right.
But it just gives you increased ability for that 36 hours.
But you know what, Dominic, I'm gonna tell you, man. This is where it started. By you sharing your story.
Yeah.
Cause looking at Dominic, Dominic fit, nice looking dude. Dominic got a good job with your police officer. Everything is in line. Everything look good on the outside. But a lot of times we don't tell the story about the inside.
What you done went through.
Yeah, so by Dominic doing this a start.
Yeah.
It's a real start, man. You letting your pride go, letting people understand, and we need these type of conversations. I know we talking about penises and all that. Well, we need to.
Yeah.
We men.
But that's
we men.
And Doc will tell you, when I was going through it, I kept telling him, "Hey man, I'm gonna be an advocate when I'm done with this.
Yeah, I know.
Yeah, that'll be good.
From the time I told you and I called you, I was like, when this is all said and done, I already know. When you get through all this, you're gonna tell everybody else because that's what you do. You go out there and try to help.
I want to share, and I had y'all in mind. Like no joke, I said I'm going on Troof Be Told. I'm gonna call them dudes and tell them we need to put this out. Because it started concerning me when I realized how many of us was going through it.
Absolutely.
And when I got on that support group, and I saw all these men on that support group and how they talking and helping each other out, then I say, man, we suffering in silence.
Yeah.
You follow what I'm saying? Because we too prideful. You ain't gonna let me know. No, man, guess what? I'll be the person to kick the door open. Yes, I went through this. I had this, but I'm back and I'm ready to help everybody else. And dude, my number or what have you, I'm here to walk somebody through this journey, man, because I made it and I feel it's my duty because God blessed me to go through this, to come back and be back whole. I'm whole, y'all. I went whole a couple of months ago, but I'm back whole. I'm done. You know what I mean? To make y'all laugh, the incontinence and you can't hold your pee, right? Yeah. Let's talk about that. That was the most embarrassing thing that was terrible for me. I had on a pull-up.
I just about to
Check this.
I keep telling him when to pull it.
Pamper. I had a pamper. He got mad. He got mad. He was like, quit saying pamper.
It is called a pad.
I don't think it sound good for a man to say y'all like pad, man. No, you wild. Pad. True story. After surgery, and that's something else too. When you go through this, gentlemen, if you went through, you might as well be what's the people that be going to the naked places and just exposing yourself? I'm gonna be a nudist now. You know what I mean? Cause it's so many pretty women done pulled my pants down and had to work with this thing. You know what I mean? Pulling the catheter out, checking me. You know what I'm saying? All that stuff to it desensitized you. At first you're like, oh my God, this lady, is she doing it? You know what I mean? But by the time it's over, you drop your pants. So the first day when they took me to go get this catheter was the worst. You walk around with my baby, y'all. I'm glad he got them headphones on. But
he hearing this.
But my baby called it a tube.
Oh my God!
Hey Dad, what happened to your tube? Oh my God! But that day when I went, cause this doctor is really good. Some dudes have to have it for 2 weeks. This doctor's so good. 4 days, I had to have the catheter, right? So we drive back to Orlando to get the catheter out. When I'm in there and this lady pull it out, flush it and all that, pull it out, she said, Mr. Harris, come over here. I'm over there, bottom off. She said, step in these. I looked down, it was a pamper. Step away. She handed me about 3-4 more. She said, oh, you gonna need these for a while. Oh my God. Dog, when I tell you that devastated me, it devastated me. Now, when y'all talking about locking down, I wouldn't leave the house because I'm already on leave. You know what I'm saying? I wouldn't leave the house. I laid around on the couch, but I was so scared. I had a pamper on, I had a pad on, and drawers. Oh, Lord. And somebody said, well, Dominic, why you had drawers on? I said, in case somebody pulled my pants down. It looked like I had drawers on. You know what I'm saying?
That sounds like, your parents always say, man, keep some clean drawers on because you might have to go to the hospital.
Yes, sir. Man, but I have this amazing friend girl, man, that encouraged me. He was like, dude, you got to get out of this house. And she made me get out, and we went and walked in the park and all that with my pepper on, my pad, and my drawers. but it forced me to get up because I was gonna sit there until the incompetence left. But I had somebody encourage me. It's like, you're gonna be all right. Let's go. You can't do this. You know what I mean? And I got out and started moving, man. And once I started moving and accepted, the pamper left. You know what I mean?
Yeah.
I said the pamper left.
Yeah.
Once the pamper left, now I'm doing the pad. The pad was still, filling up and all that. Now I'm down to, 4 pads a day. And now I'm down to 2 pads a day because I'm starting to do the exercise.
Absolutely.
That's good. That's good.
Going to the lady, and she's like, Mr. Harris, oh my God, you're gonna recover well. You know what I mean? Because you're doing what I tell you to do. You know what I mean? I told you I went about a clicker. I'm sitting at the light doing kegels. I'm watching TV doing kegels. You know what I mean? This lady said, if I do this, I'm gonna get back right. The thing went to 1 pad. And then one day she told me, y'all, finna make y'all laugh again. One day she told me, she said, Mr. Harris, this is what we got to do. Because at night when I go to sleep, I wouldn't leave. You know what I mean? Mine was only time I get up and I start walking. And you can feel it, man. Like, it's the worst feeling, dude.
Yeah.
You know what I mean? It's almost like you're going back to a child.
Yeah.
So check it. So I'm improving fast. Like I say, I was back around about 3 months. 3 months. He said, "Hey boy, you doing well." He said people at this time was, still, 8 months, still weakened. I'm at 3 and I'm almost there. So she tell me, my pelvic floor therapist, she say, "Listen, I got some homework for you tonight." I said, "All right." She said, "Tonight, you're not gonna wear a pad at all. You're not gonna put a pad at all. And I want you to go to sleep. I'm going to see what happens." Man, I woke up, pee was everywhere. Oh, Lord. I was saying, why she told you that? It's mental.
It's mental.
It was mental. It had got to the mental part for me.
So she trying to say you could have stopped that?
Dude, I went back. Me and her, boy, I said, you set me up. You got cameras on me. You know what I mean? You tried me. She crying, laughing, she giggling. I said, man, my tape top and everything. You know what I'm saying? Pee all up on my balls. And she laughing, we laughing. She said, do it again. Do it again. I said, She said, no, do it again. I ain't have to wear no pad since.
Wow.
You did it again, Dominic?
I had to, man, because I wanted to be well.
Yeah.
And I did.
You want to be dependent upon.
And that's what she
no
said.
one else
Yeah.
is
She
safe
said,
in that
mental
area.
part. That's where the mental part
dependent on
come
it,
in.
Dominic. You dependent, dude. And once I got the muscle built, the pelvic floor, once I built that muscle, because what happens is, let's go back. When you take out the prostate, you got 2 sphincters. You got an inner sphincter and an outer sphincter. Y'all, I learned this crap. It's all good, dog. I learned this crap. Well, you got an inner and an outer sphincter. When they remove the prostate, your inner sphincter is removed, and now your outer sphincter that stops the pee. That's all you got. You got to build that up. So that's what I was doing, going to the pelvic floor, is building those muscles up.
Gotcha.
And then she got me to the part where she said, you're going to have to pee. I need you to go from 30 minutes to 2 hours to go to the bathroom. You know what I mean? I had to pretty much retrain myself, y'all, after that, to how long I can hold it. You know what I mean?
Right.
And she got me there, and then she said, do it again, y'all. And I ain't had a pad.
That's awesome, man.
Yeah, man.
So let me ask either one of you. And here's the frustrating part: is that people die from colon cancer and prostate, but there's no need to die from prostate or colon cancer. Is that right, Doc?
We can get the rates lower, right? So unfortunately with cancer, it can never be 0.
Okay.
But there's no reason to be diagnosed with advanced stage prostate cancer, which is what people die from. So if people would get their PSAs, if people would go get checked, if people would pay attention, no question that overall death rate would be much lower. So percentage-wise, the death rate of prostate cancer, percentage-wise meaning like if you look at the percentage of people who are alive 5 years after prostate cancer, it's actually a pretty high number. It's like above 90%. But the sheer number of people who have prostate cancer means that the total number of deaths is still 30,000 a year. If people were to get their PSAs more often, we could drop that number down easily, because of that 30,000 a year that died, the vast majority of them are being diagnosed at a late stage where it's not curable. You get diagnosed at an earlier stage, it's curable, so then you got fewer deaths, like I said, each year. Colon cancer is even a bigger impact, because the 5-year survival of colon cancer, again, all comers, is probably more in the 70-80% range. You find a polyp. A polyp is a colon cancer waiting to happen. So that's why it's so important to get these colonoscopies, because you don't know if you got a polyp. People are like, well, why would I go and shit all night and then take a picture, somebody should have a camera in my butt? Well, because the point is you catch a polyp. That polyp in 5 years is going to be a cancer that now you're talking about taking part of your colon out. Now you're talking about chemo, radiation. Now you're talking about this going to your liver, and now it can't be cured. So that's why, stuff like that, when you can get you real early, yeah, you could never get it down to 0 deaths, but you could definitely reduce the numbers big time.
Well, let me say this, man. I want to, Dom, I want to thank you for even sharing that with me. I want to thank you, because what that did for me, because I had already been thinking, like, man, I got to do colonoscopy. I didn't really know about PSA at the time, but I knew colonoscopy just because we always kind of hear that. That don't mean that we react on that. It don't mean that we actually go do it. I sat back since 40 saying that, hey, man, I need to take the colonoscopy. Because I'm uneducated on the process, I was scared of it. I didn't want anybody to go in my butt and do anything. So, but when it got closer to me, when it hit home with you and my brother, I know my dad had prostate. Like, man, I got to effing go and do something. So I hadn't had a doctor. At the age of 48 years old, I got a doctor now.
All right.
Because I got a doctor, and because of what you shared, I went and did the PSA. I'm pretty good with that.
All right.
I went and did my colonoscopy. They found a polyp there.
Removed
that. The doctor said that this did the study on it, and it was a high risk polyp. But had I not,
come on, man. Come on.
Had you not,
you know what I'm saying? That's the part.
That's why we doing this.
If we don't,
That's why we doing this.
go and get checked out. Just like that polyp could have been there at 40 or 35, whatever. Continue to let it go on and go on and go on. My life could be a lot different.
Oh yeah.
Just as well as other people that allow for this type of stuff to happen and don't go get checked, can devastate. You got to look more than just yourself, because of your family as well. You know what I'm saying? So imagine what that do to our family, because all of us had somebody in our family that has cancer. Now, if it's colonoscopy, if it's colon cancer, prostate cancer, whatever the case may be, what I do know is, like you said, it's a drastic change of the number if we do go get checked out.
Oh yeah.
Period.
And that's your message.
That's my message, man. That's what I want to open up to everybody, man. Go get checked, and then talk to somebody. Talk to somebody. Call me. Call somebody to talk about it. And then I'll share this right quick. Like, I lost my sister. Just lost my sister in February, the 20th. My sister had cancer. And like you said early on, T Green, hurting, feel the pain, but didn't want to go get diagnosed. Was just a soldier. I could take it and all that. And she passed, man. And when I tell you survivor guilt and all that I had, you know what I mean? And she from the same dad, you know what I mean? And she didn't get checked. That thing broke my heart, man. That thing hurt me. That thing hurt me so bad, man. Because I was spared because I caught it early. You follow what I'm saying? And she was strong and I'll be all right, and didn't want to know, and she passed, man.
And that's the problem. Being afraid to find out, man.
Right.
Because I'm pretty sure everybody in here lost somebody in their family with cancer.
Yep.
You know, I lost a brother. My oldest brother, he died at 12 from Burkett. Man, we talked about that. Yeah, at 12, man, 11, 12. And but like I say, we're afraid to go find out. You know, you shouldn't have to be afraid. And to guys, I'm talking about men. The most important thing to a man, I'm talking about a real man, I'm talking about 100% per man. I ain't talking about no 80% man, 20% you want to be this. 100% per man, the most powerful thing to us is a woman. So these men got these wives, these girlfriends. They need to tell the men to go get checked out. Because we'll listen to women now. We'll listen to women before we listen to them guys. So these women need to tell these guys, go get checked.
Go set the appointment.
Yeah, go get checked, man. Go get checked, man.
Yeah.
Go get checked, man. And like I say, I done did the colonoscopy. I gotta do this. I'm gonna do prostate. I'm gonna go through all this. Cause like I say, I'm finna be 55. Man, yeah, I feel good.
Right.
I don't know if I'm good.
Right.
But I feel good. You know, listen to this. You got to go get checked. Cause you don't know, man. You don't know, man.
In that brewing.
Yeah.
It be in that brewing.
You don't know, man.
Like you said, that fear and that pride, you gotta let it go.
Yeah, man.
Because just not wanting to know, not checking because I feel all right. It's even akin to high blood pressure, right? You got people, and I see it all the time. Why would I take a pill if I feel fine? That sounds like a normal thing to say. But then I come back and say, because your pressure is 180 over 100, and carrying that for 10 years, you're going to stroke out, your kidney's going to go bad, or you're going to have a heart attack. But then when all that happened, you can't go back 10 years because you've been sitting with this blood pressure all the time. So, you know, unfortunately, you know, we in the community oftentimes is like, you know, not a whole lot of trust in the medical community. I ain't trying to go in there, whether it's cost, whether they don't talk to me right, whether they don't talk to me at all, whether I don't understand. I get all that, but you got to be your own advocate. You got to understand that, you know, I deserve to have the same health care as somebody else. I deserve, you know, to have the same opportunities. I'm not going to let my own fear, my pride, might not want to talk about it, might not want to deal with any possible side effects, scare me from being here for my family, for my kids, you know, especially something that could be taken care of.
What are some of the symptoms? What are some that we can look out for that can say, you know, even if we, you know, we don't necessarily... Well, you know, we ask that everybody get checked out, but it could be someone just sitting home, could be having some symptoms right now, don't know.
Yeah.
Right, what are some symptoms?
So, truth of the matter is, there are not really any real symptoms for prostate cancer.
Okay.
There lies the issue. Right? You know, we talked about the fact that the guy, you know, he had a lot of peeing going on, and the guy had a good doctor. He's like, well, let me just check this out. But truth of the matter is, frequent urination isn't really a symptom of prostate cancer. Now, if you having blood in your urine is never normal. So you got blood in your urine, you need to go see a doctor to get checked out. Could just be a bladder infection, could be prostate, could be bladder cancer. So blood in urine is never normal until being checked out. So that's one thing. If you see that, get it checked out. If you suddenly got a change in how you peeing, you normally get up once a night, now you're getting up 3-4 times a night, go get that checked out because, again, it could be an infection, could be something else happening. Of course, if you're having some new pain that you ain't had before, and we all gonna have pain, but I'm talking about a pain that ain't going nowhere. Like it's getting worse, affecting how you sleep, eat, walk, drive. Or if you got unexpected weight loss, you know, you're not trying to lose weight, you suddenly lost appetite, you lost a bunch of weight. You get that checked out. You know, you feel pain that, you know, your belly bloated all up that you don't normally have, but it's not going away. Get that checked out. Listen to your body, right? You know, some things when we're talking about just doing screening, your body feel normal. So that's what colonoscopy is, a screening test. You don't get a colonoscopy once you start bleeding. You get a colonoscopy when you feel normal because you're trying to find something before it happened.
That point right there, Doc.
Exactly.
Say that one more time. What do you say?
The whole point of a screening test, you're trying to find out before you start having symptoms. That's the whole point of a screening test. You don't wait until you feel a lump in your breast and then you're like, oh, I better get a mammogram.
Yeah.
You don't wait until you know you shitting blood.
Yeah.
Oh, let me get a colonoscopy.
Yeah.
You know, you don't wait for that stuff. You know, when they had these guidelines in place so that we can diagnose you earlier if you have it. Or like, you know, avoid all the big stuff, right? If he doesn't get this checked out now and he waits, right? The cancer ain't going nowhere. One thing about cancer, it don't stop growing on its own. You know, it's not what it does, right? So he don't get this treated now. In 5 years, now the cancer can't be cut out. Now he's got to have, extra treatment. Now the chance of cure is much, much lower. Now this is something he's going to be dealing with for a long time because now it's like a, radiation and chemo and all this other kind of stuff.
Somewhere else.
So all that is avoided by acting early, not being afraid, not being prideful, and, just taking care of yourself.
Take care of yourself.
Yeah, man.
Take care of yourself. You know what, man? I appreciate both of y'all.
Man, thank y'all.
And because of that, man, we're going to team up.
Yeah.
And we want to have a free prostate screening in the community of Manatee County and also Sarasota County. So next month will be the jump off for Troof Be Told presents a free PSA screening for the community at 13th Ave. You'll be hearing and seeing more about that. And then we'll move to Sarasota also and make sure we do something down there. And we want to do it in the heart of our community.
Yeah.
That's the part. In the heart of our community because, Green, I want to add to that. We got the youth center right here, too. We want to probably do something like that as well.
Yeah.
But what we want to do is try to get as many people out as possible, all our men. Black, white, Hispanic, it doesn't even matter. But make sure everybody come out. Get themselves tested and screened, so you'll know. Like Doc said, the thing is, we want to make sure we get it before we hear or see any type of symptoms.
Yeah, man.
That way we can be in the forefront of things instead of trying to catch up in the rear.
Exactly. It's
y'all come on out, man.
Instead of reactive.
Yeah, and that's the part. Don, man, a testimony that I think really will touch other people just as well as it touched myself, man.
Appreciate it.
Definitely appreciate you. Definitely appreciate you being willing to share this story.
Yeah,
Even from the moment when you was in the process, you were thinking about getting the message out, right? That's a testament of just who you are as a person.
Thank you.
Wanting to take care of the community like you always have. I don't know, T Green. I know you haven't did a PSA, brother. So I don't know what the problem is.
Oh yeah, I'm doing it, man. I'm gonna do it. Ain't no problem. I'm gonna do it.
You're gonna do it in 13 after that screening?
Yeah, I do it.
All right.
Real, I ain't scared. Real.
All right. That's what I'm talking about.
I'm doing it, man.
Desiree, you got anybody you gonna invite?
Yeah, I'm doing it.
Yes.
Make sure they come out. You know,
I'm doing it, man.
Hey, we want to make this thing really big, man. I asked the guy that we partnered up, Dave, how many people typically does he get to his PSA screenings and stuff like that? And he mentioned, the number. I was like, we got to blow this out of the wall.
Yeah. That was a low number.
Yeah, that was a low number.
It ain't a line. That number is real.
I think he said around
17 or something like that.
17. Yeah. 17 people.
That's what he said.
Less than that.
That's what he said.
And we trying to blow that number out. So
We got to. It's important.
17 people.
That's what he said.
So we can have music and stuff out there and all that. We getting them out of there now. Yeah, they coming.
They coming.
Yeah, they coming
For sure. And like you said, I think it was a good point. Any wives, sisters, mothers listening, friends, they oftentimes will get the guys out. Like seriously,
man.
because this is how we are. So I'm okay. I'm
definitely gonna put it out.
We coming, man.
And even just take this recording and send it to them.
Yeah.
You know what I mean?
Yeah.
The wives and sisters and all that. Take this and send it to your male friend or brother or uncle or dad so they can see this and see what we talked about, and if they going through something, you know what I mean?
Yeah.
Hey, and
I'm here,
man. I'm here. If anybody want to reach out and talk to me about it, man, y'all get with Troof Be Told. They got my contact information, man. I'm here to talk. And I would love to see us make a support group.
Yeah.
You know what I mean? If you have enough people come up, I would love for us to make a support group where we can get on a closed social media thing where we can talk and share experience and what people went through, because I'm telling you, the one that I got on was very, very helpful. But we need one with us where we start, getting out there and being honest, you know what I mean, and straight up.
The good part about this, man, I really feel like you're going to save lives.
Yes.
Yeah, man, we're going to do that.
You know what I'm saying? You're going to save lives, man. And you never want to lose a king because a king being
Stubborn.
stubborn.
Right. Yeah, man, we're doing it.
Or scared.
Or scared.
Yeah.
at the end of the day.
Yep.
You know.
Yep.
So be on the lookout for that, guys. Dom, thank you so much.
No, thank you.
Dr. Fitch, thank you so much, man. I mean, the information that you put out there, man, is
It's big.
God, dog, man.
Probably one of the most important
Absolutely.
episodes we done had, man.
Yeah.
You know, we trying to save lives.
Really, that's all we know. Keep it real and authentic. This truth be told. Only the truth. Tune in, cause you gotta watch. It's like you with us while we kick it in the barbershop. Here to motivate and inspire. Hosted by the real deal and the God Barber. I hope that you ready. Keep it funny and edgy. Let's go. You already know. Truth be told. Let's go.